Hello and welcome to the Pharmacy Informatics Professor 2020 with your host, Dr. Armin Simonian. I think biosimilars is one of the most recent new categories, major categories of drugs. And I'm still trying to figure out biosimilars and where they fit in with our practice. And as a pharmacy informaticist, database builds. So these are products and they're not generics. And I ran across an interesting article in Pharmacist Letter. And I've been thinking about this article. This could really have an effect. It's a little bit of a dilemma on how we dispense medications and just pharmacy practice in general. So I wanted to make that the subject of my Journal Club episode this week and talk about biosimilars and the bit of dilemma that it causes with regulations and with our drug databases in our systems. So let me bring up the presentation. It's a short one, but has a lot of good information that I think will get us to really think about what biosimilars are and how we're going to handle them in terms of preparation and dispensing. So this is the article I'm referring to. It's the topic is explain why Semglee will be interchangeable with Lantus. So Semglee is a new brand of insulin glargine, and you see the biosimilar style name there, YFGN-E100, and it will be the first interchangeable biosimilar. And this is the word that really caught my eye and got me to thinking. I was practicing, interning, and then starting to work as a pharmacist at a time when generics were becoming more and more popular. And we had companies that were just out there designed to create a lot of generic products on drugs that had the patent that had run out. And we were starting to see the little checkbox on our written prescriptions that said, do not substitute. So if the prescriber really wanted brand name Dilantin and did not want a phenytoin generic substitute, they would write Dilantin and check the little box. Now, when it comes to this new product, Semglee, it's not as straightforward, and I'll tell you why. The clue is right here in the first sentence that they have in this article. It was originally approved as a new brand of insulin glargine, not a Lantus generic. So if you switched between Semglee and Lantus, it required a new prescription. Now that's changing with this designation of interchangeable. And I really don't know how we're going to exactly handle this, but maybe you have some thoughts on the prescribing and dispensing of these medications. So just to kind of summarize some of the main points of the article, Semglee, as we said, is the first interchangeable biosimilar. Biosimilars are not generics. They are biologics are made from living organisms, and they're large, complex molecules. It's impossible to create an exact copy of the original or reference biologic. And so we don't call them exact duplicates. We call them similar. So they're biosimilars because it's impossible to have an exact copy of the original. So a biosimilar is not considered a generic substitution. And typically a new prescription is required. Now with this word interchangeable, therapeutic substitution with the same clinical result, so no new prescription is required. We've talked in the past about therapeutic substitution. You have so many beta blockers out there, and your hospital does not want to carry every single beta blocker available. So you select kind of your main beta blocker, and then if a prescription is written for a different beta blocker, we go through P&T committee, we get approval to do a therapeutic substitution. so that we can substitute one beta blocker for the other. And that's our standard for our institution. So this is kind of taking that concept of therapeutic substitution, not generic substitution, especially when you have the same clinical result. So it's the same drug, basically, and it has the same clinical result when it's used in the patient, administered to the patient. So this is how the word interchangeable is being defined. Now, they did say in this short article that it's going to be important for the pharmacist to consult with their board of pharmacy to look at the regulations, because it's going to be different in every state. And I imagine that this is a question that's going to have to be addressed by every board of pharmacy. And we're really going to have some maybe new regulations or new guidelines on interchanging these biosimilars. So it's the first thing I thought of is if a prescriber writes for Lantus and says, do not substitute, we're not supposed to substitute a generic glargine. But if we have an interchangeable product like Semglee on hand, can we automatically dispense Semglee even though the doctor wrote, do not substitute? I don't know. Maybe you think that it's pretty straightforward, but for me, it's a question mark, and we'll have to see how this plays out. But I wanted to bring this to everybody's attention because for a pharmacy informaticist that's building Semglee into our system, if you have Lantus and you have generic glargine or different glargine products, you have to decide how you're going to build them in your system, what's going to pop up for prescribing when the prescriber goes in and tries to look for Lantus or for glargine. So it does have implications for database building, and that is why I brought it to the Pharmacy Informatics Professor 2020 to talk about, because this is something that directly affects us both in pharmacy practice and in our specialty area of pharmacy informatics. If this was a stimulating discussion and caused you to stop and think about how you dispense glargine products, then please like the video and subscribe to my channel, and I'll thank you for that. And in the meantime, stay safe, stay healthy, look after the health of others. I'll continue to work on more episodes, and I hope to see you next time. Take care.